Welcome to the We Level Up Treatment Center video series. In today's video we will discuss: what are intrusive thoughts? Intrusive thoughts are thoughts that seem to become stuck in your mind. They can cause distress since the nature of the thought might be upsetting. They may also reoccur frequently, which can make the concern worse. Intrusive thoughts may be violent or disturbing. They may be thoughts of a sexual nature, including fantasies. They can also be about behaviors you find unacceptable and disgusting. These thoughts, however, are just thoughts. They seemingly appear out of nowhere and cause anxiety, but they have no meaning in your life. They're not warning messages or red flags. They're simply thoughts. What gives them power is that those who experience them become worried about their significance. As a result, people may fixate on them and become ashamed, intent on keeping them secret from others. Intruding thoughts are harmless as long as you are aware that they are merely thoughts and you have no desire to act on them. What conditions include intrusive thoughts? Anyone can experience intrusive thoughts. More than 6 million people in the United States may share them. Unfortunately, many more people may not report them to their doctors or therapists. Intrusive thoughts aren't always the result of an underlying condition. However, they're also not likely to indicate you have a problem that requires medical attention. However, intrusive thoughts can be a symptom of a mental health condition for some people. Obsessive-Compulsive disorder. Obsessive-Compulsive disorder, OCD, occurs when intrusive thoughts become uncontrollable. These thoughts, obsessions, may cause you to repeat behaviors, compulsions, hoping you can end the views and prevent them from occurring. Examples of this intrusive thought include worrying about locking doors, turning off ovens, or fearing bacteria on surfaces. A person with OCD may develop a routine of checking and rechecking locks or washing their hands multiple times a day. In both cases, this is an unhealthy result that interferes with their quality of life. Post-traumatic stress disorder. People with post-traumatic stress disorder, PTSD, often experience intrusive thoughts connected to a traumatic event. These thoughts may trigger some physical symptoms of PTSD, such as increased heart rate and sweating. Sometimes, these thoughts can be so severe they lead to flashbacks and intense psychological distress. Eating disorders. Those who struggle with eating disorders may have disturbing ideas that are bad for their mental health. The thoughts can eventually damage their physical health. People with an eating disorder frequently worry about the physical impact food will have on their bodies. That, in turn, leads to significant distress about eating. Moreover, it could lead to other actions, such purging, to block the thoughts. What causes intrusive thoughts, and are they normal? Although we don't know why these ideas just come to us out of nowhere, some psychologists have theories. For instance, psychologist Lynn Summerstein, 2016, contends that persistent or frequent intrusive thoughts could be indicators of a person's life being challenging or going wrong. Perhaps they are trying to contain their frustration as they deal with relationship issues, stress at work, or parental challenges. However, instead of staying politely buried, it finds other ways to work up to the surface. We don't know where they come from, but they keep coming back to disturb you while you sit there and think about them. We think about something more often the harder we attempt to not. Suppose I tell you not to think about a purple elephant. Then you can think about anything else in the world. But try to resist having a mental picture of a purple elephant appear. How long do you think you can resist before doing so? The majority of individuals quickly give in to the image they have been told not to see. Are intrusive thoughts normal? Yes. Yes is the short response. Thoughts are all that are intrusive. Even if you are mentally well and have no significant mental health conditions, it is still possible to experience intrusive thoughts out of the blue. However, you shouldn't be very concerned about this. Does everyone have intrusive thoughts? Almost everyone has intrusive thoughts, or ideas that seem entirely arbitrary. Even though intrusive thoughts can be positive or bad, it is generally the latter that causes the most pain. Intrusive thoughts may be a sign of a mental health issue for some people. Do intrusive thoughts mean anything? If you are wondering, what if my intrusive thoughts are real? What does intrusive thoughts mean? Or, what are intrusive thoughts a sign of? The answer is they often pose no threat. But if your daily life is disrupted by your obsession with them, this may be a sign of a deeper mental health issue. Obsessive-compulsive disorder, sadness, or anxiety can all show symptoms of intrusive thoughts, OCD. How long do intrusive thoughts last? The duration of an intrusive thought cannot be determined with ease. The truth is that it differs from person to person. These ideas are little more than a blip on our radar when we have a functioning, neurotypical brain and a solid understanding of how to monitor and let them go. However, you may have a severe mental health issue if you regularly deal with unwanted, violent, disturbing, or bizarre thoughts. The two most common diagnoses associated with intrusive thoughts are anxiety and obsessive-compulsive disorder, OCD. You might have one of these diseases if you believe you have more intrusive thoughts than usual or if you frequently think about them. How are intrusive thoughts diagnosed? Speaking with a healthcare professional is the initial step toward receiving a diagnosis. They'll review your symptoms and health history. Then, they may conduct a complete physical exam and, in some cases, a preliminary psychological evaluation. If they discover no physical condition causing your intrusive thoughts, they might recommend that you see a mental health expert. These people have received training in identifying the warning signs and symptoms of conditions like OCD and PTSD that could result in intrusive thoughts. You and your therapist will investigate the thoughts through one-on-one sessions to learn when they happen and how you react to them. This will assist them in making a diagnosis and determining if there is another potential cause. The primary difference between intrusive thoughts in clinical anxiety and those that do not is how these thoughts are appraised. The likelihood that people with clinical anxiety would perceive their intrusive thoughts as destructive, immoral, or hazardous increases. These interpretations typically result in emotional arousal, which heightens the perceived intensity of intrusive thoughts and causes attention to be drawn to the idea. We Level Up Florida Treatment Center provides world-class care with round-the-clock medical professionals to help you cope. In addition, we work as an integrated team providing information about intrusive thoughts and other aspects of treatment. Make this your opportunity to reclaim your life. Call today to speak with one of our treatment specialists. Our specialists know what you are going through and answer any of your questions. Your call is private and confidential, and there is never any obligation. That's it for today. Please subscribe and hit the notification bell. Like, share and comment. We would love your feedback. Have a great day.